Good evening, everyone. Good evening to one of our most treasured times here in the fellowship program, the day that we get to celebrate the accomplishments of many. I'm Dr. Erica Capilouti. I am the Director of Fellowship and Education here at the Academy. And I want to very warmly welcome you to the 2023 graduation ceremony for AIHM's Interprofessional Fellowship Program in Integrative Health and Medicine. I want to warmly welcome our graduating fellows who are here in the audience. I also want to take a moment to acknowledge their families and their friends who have accompanied them on this 2-year journey, however it may have evolved. I also want to acknowledge the fellows who were not able to join us here in person, but who are joining us virtually, and extend that same acknowledgement to their family and friends. And I also want to just take a moment to see if there are any current fellows in the audience that are here, and if so, if you would stand up. And to also acknowledge our alumni. If any of you are here in the audience, please stand up. And they certainly know the road traveled, having done this before you. So before we move on, I just want to give you a little bit of background about the fellowship program for those of you who are not familiar with it. But basically, this is a 2-year, 1,000-hour program that covers the breadth of integrative health and medicine. And as many of you, particularly family members and friends, know, this is something our fellows embark upon while many of them are working full-time or part-time, raising families, and dealing with the curveballs that life can throw. So we ask of them usually an additional 8 to 10 hours of work a week on top of their already busy schedules. The program is really unique in that it is truly interprofessional. So our cohorts have doctors, nurses, nurse practitioners, pharmacists, chiropractors, physical therapists, acupuncturists. And in that setting, we cultivate an educational environment that is very deeply enriching and is really transformational. It also is a curriculum that places a very strong emphasis on self-care. And we hear time and time again from our fellows how important that is to them, where they actually have to stop and spend some time nurturing themselves in the context of busy clinical practices and busy family lives. And I can't tell you how much joy and pride we at the Academy and on the fellowship team in particular have watching them all make this 2-year journey with us and the transformation that occurs. I mean, that transformation happens not just on a professional level, but on a very deeply personal level as well. And so for any of you who have been participating in the conference, you know, if you're paying attention, you know that we are at a very, very critical point in integrative and whole health. We are really on the precipice of something extraordinary happening. And all of you are going to be an integral part of the change that is coming. And many of you are already doing it. I know that some of you have started your own practices or are building practices. You're bringing what you have learned to your hospital systems, to your communities, and you are already having an impact. And that is why we are here. And we are excited for your future. We are excited to see what you will continue to do and how you will move integrative and whole health forward. So I say, we are extremely grateful that you have chosen to do this work with us. We are grateful that we have been able to travel this part of your journey with you. And we are absolutely excited to see what the future holds for each of you. And we hope after this, as you will all be alumni, that you will continue to remain engaged with our very active alumni association. Maybe some of you may serve as mentors for our rising fellows, and some of you may help us teach our curriculum. So on behalf of the team and on the board and all of the academy, we just are so proud of you and grateful that you're doing this and really want to see what the future holds for you. So before we actually present, we have two cohorts that we'll be presenting today. Our spring cohort, cohort 10, and our fall cohort, cohort 11. And we just started recruiting, and our most recent cohort 15 started, which is hard for me to believe, but it is wonderful. We have asked two of our fellows to say a few words about their experiences in the program. So I want to first, we'll start with Dr. Cindy Tsai, a medical doctor who is from cohort 10, and then we'll hear from Maria Colon Gonzalez, a medical doctor from cohort 11. So ladies, if you want to come on up, please.
Thank you. Thank you, everyone, to all the friends, family, faculty, and fellow graduates. Thank you for being here and joining in today. It's an honor, and I am so excited and grateful to celebrate this milestone with you. I know that we each have a powerful story and journey that led us to integrative medicine. And it's no accident that we're here today. For me, it was when I woke up one day not being able to see. This happened to me years ago when I was in internal medicine residency training. And I talked about the experience in my TEDx talk on body intelligence, about what it was like to wake up and have the whole room look dark and blurry. I was confused about being a medical mystery. And I was diagnosed with a rare 1 in a million type of condition, an autoimmune disease, an autoimmune uveitis, or an inflammatory condition impacting my eyes that could have led to full blindness. I remember being young and terrified. All my labs were normal, but my prescription increased threefold overnight. I won't forget going to see the ophthalmologist and him looking at me and saying, "This is interesting." And as clinicians, we know what that really means. And as patients, nobody ever wants to hear that from a doctor. I was started on all the serious medications like steroids and immunosuppressants. And I was so motivated to get better because I didn't want to take medications for the rest of my life if I could help it. And even though I experienced a lot of frustration, confusion, loneliness, and helplessness as a patient, I so desperately wanted to get better. I wanted to believe that it was possible to heal and to be, quote, normal again. And this is what led me to integrative medicine. I'm so grateful that the academic hospital I trained at had an integrative medicine center. And so I started working with a number of holistic practitioners in addition to my Western medicine specialist team. And I gave myself permission to explore and assemble my own healthcare team. And I saw that it wasn't either or, it was yes and. We're not limited to only one way of treating a patient. We don't have to choose. And it's through working with these integrated practitioners who truly listened, who focused on treating the root cause, and who looked at me not just based on numbers on the lab report or only focusing on one individual body system in isolation, but rather looking at me as a whole being, as a whole person. And I was and felt seen with respect and autonomy. And I became my own best health advocate. And thankfully, with all their expertise and guidance, was able to heal my eyes. And I knew that integrative medicine is not just a possibility or option, it's a necessity. Because integrative medicine is about blending the best of all worlds. And we know that our current healthcare system is broken. Sure, it's great at managing symptoms of illness and prolonging life. But who wants to live to 125 with dementia and be bedridden all day? I certainly don't. And what we really want is to be well and fully alive, to experience all the wonders and joys of the world, to make an impact and to leave the world a better place. Now, many of us came to medicine because of service and altruism. We are givers, we want to help, but oftentimes we forget to take care of ourselves. We think it's okay to do it later because others need us right now. But if we don't practice self-care and self-compassion, there will be no later. We want to do it before we think we need it. And I can tell you that my illness was definitely related to burnout. And I had to learn to pause and to listen to my body. And it was awkward and uncomfortable. But as I always like to say to patients, to clients, that to know and not do is to not know. To know and not do is to not know. We have to practice what we preach and to lead by example as best as we can. When we take responsibility to make sure that we're in a good place ourselves, we show up better, we have more to give, and we're the best version of ourselves. And with that, that's when we can really truly promote health in others. What I really appreciated from our fellowship training was the interprofessional aspect, to share and learn from each other. With our diverse backgrounds, trainings, expertise, and experiences. Because every single one of us has a gift, a purpose, and something so special that only you can share. There are people who are waiting to hear from you, to learn from you. Friends, families, colleagues who trust you completely. And the only way our community and world will change is if we each do our part and lead the way. Every one of us is a healer. It's not about the letters you have behind your name. Every one of us can make a difference. It starts with caring for one person at a time, and that person telling another person and another person. And together we create a ripple effect to make the world a better place. So, my dear colleagues and friends, the future is you. The time is now. Be brave, go out there, and shine your light. Thank you so much.
So let me tell you a story. It was a sunny spring day, but my back hurt as I drove to my clinical rotation. My deviation in my upper back started to give me pain as an adolescent. Even thought I have learned to take care of my body, some days I just have pain. I had a wonderful mentor, Sarah Ansola, a Chinese medicine doctor. Every day when I arrived, she would tell me, relax, eat, no rush. When did I hear relax from any of my attendings in residency? Never. When she noticed my pain, she quickly said, take a break. Let me give you a treatment. A treatment for me? Don't you have paying patients to see? I thought quietly in my mind. Let's face it, when in healthcare do you stop for an unpaying patient? Seldomly. She probably noticed my face and she said, don't worry, it's okay. I have time. I got ready in the room as I laid in the warm bed. And to my surprise, she returned with a heart shaped cupping set. Pink hearts, I thought, so cute. Then she said, I want you to think about ways to love yourself while resting. Then she did her magic with the cups and the needles. I lay semi naked in a warm bed, light steam, yummy smell in my body, relaxing music, asking how to love myself. When she returned, she said, remember to love yourself each time you see the hearts in the mirror. Have you ever had an experience like this? Perhaps if you were taught and a conventionally trained clinician, you were taught to keep distance from your patients. Working with Dr. Sarah taught me a lesson I want to share and invite you to put into practice. Creating a healing space for yourself and your patients. Have you ever wondered why the buildings designed for the sick are full of alcohol smell? It is also full of noises that elevate blood pressure, and lights might not even go out at nighttime, affecting the circadian rhythm of those we're trying to help. Nature at times is nowhere to be found, yet nowadays we're writing prescriptions for forest bathing. We design spaces functional for oversized wheelchairs and stretchers, but we do not create environments that foster healing. Then comes the emotional component of care. Maybe mental health clinicians ask their patients, how can you love yourself? But let's be honest, it's not something a lot of people in this room might ask, much less tattoo hearts on a patient's body. You may say, I have nothing to do with this. This is the responsibility of the administrators. But is it? My invitation is to learn spatial healing. Healing spaces are designed to nurture patients' physical and mental well being by fostering environments of happiness and tranquility for the workers, the patients, and their families. Even your small office can be rearranged. You can bring in elements of nature. I wish I could bring my dog to work every day. Pet therapy for the healers and the patients. In the room where we examine patients, we can bring in more sunlight with small windows, skylights, or even stained glass while keeping the patient's privacy. Can we invite more silence and create a sense of safety for our patients? Or have relaxing sounds like water? Beauty should be everywhere. So why not have balconies with scenic views? And then comes the issue of loneliness. We don't want to spread germs, do we? Spatial healing is known for creating open spaces to foster interpersonal relationships. I was also taught not to use perfumes because I could cause an asthma or allergy attack. However, I have discovered that people prefer smells that are not pungent or musty. Aromatherapy enhances relaxation and fosters an environment of calmness. Often, the buildings designed for the sick are not conducive of healing, with alcohol smell, noise, inadequate lighting. It is often driven by budget constraints and a focus on meeting the physical needs of the patient while ignoring the emotional and spiritual aspects of healing. The result is that the place where people seek recovery may cause more illness. I learned that we should love ourselves while resting. I also learned that we can provide professional care while attending to the beauty of the space and the spiritual and emotional needs of our patients. By creating healing spaces of rest, we can help patients heal faster and more effectively. Lastly, let me share a quote from Healing, a Concept Analysis. Healing is a holistic, transformative process of repair and recovery in the mind, the body, and the spirit, resulting in change, finding meaning and movement towards self-realization of wholeness, regardless of the presence or absence of disease. Thank you.
Thank you, ladies, very much. All right, I'm going to have Jess come up, and we're going to present our graduates to all of you.
So as I read these names, I just want to say how blessed I have been to get to know each and every one of these graduates. And as we call out their names, I'd like everyone in the room to think about the 2 years, sometimes more, that has passed, all the hard work, the nights, the work they're usually doing, and this on top of it. And I'm just so honored to be here today to call out all of your names. Wish I could even see you better right now. But this is for you. Antonieta Barrientos, medical doctor. Idara Aguilar Tejedor, medical doctor. Fozia Asif, medical doctor. Sanjana Chaturvedi, medical doctor. Chelsea Darling, certified physician associate. Nancy Egan, certified registered nurse anesthetist. Maria Camila Henao Solarte, medical doctor. Pavitra Kakumanu, medical doctor. Sepide Kazemi, medical doctor. Jatinder Kaur, medical doctor. Ziad Mirza, medical doctor. Lucille Morris, medical doctor. Karat Ul An Nawab, medical doctor.
Annie.
Trang Wen, doctor of pharmacy, with honors. Jeanette Pilner Martin, medical doctor. Simona Pop, medical doctor. Ashley Rude, family nurse practitioner. Rama Salveker, medical doctor. Jennifer Sedor, medical doctor. Julie Sullivan, medical doctor. Gulnara Taldibeva Bugliese, medical doctor. Cindy Sai, medical doctor. Vinicius Neves, medical doctor. With honors. Lindsay Youngquist, medical doctor. Congratulations, Cohort 10. Corrine Bloom, medical doctor. Jiwei Zhang, medical doctor. Maria Colon Gonzalez, medical doctor. Alini Dandu, medical doctor. Valerie Ebel, medical doctor. Ginger Epling, family nurse practitioner. Svetlana Fisher, medical doctor. Mauricio Glenny, medical doctor. Priyanki Heidelberger, medical doctor. Jessica Hoxson, medical doctor. Lauren Kim, medical doctor. Joby Matthews, medical doctor. Robert McCarran, osteopathic doctor with honors. Shazli Nasir, medical doctor. Sarah O'Connor, osteopathic doctor. Sean Olson, medical doctor with honors. Landon Opunui, naturopathic doctor with honors. Sadia Parekh, certified physician associate. Kirsten Sampera, medical doctor. Deven Sharma, medical doctor, non-clinical with honors. Jigyasa Tiwari, medical doctor. David Valero, medical doctor. Jill Vesey, medical doctor. She might. Sindhu Yarabelli, medical doctor. Tanya Sartucci, medical doctor with honors. And we give you cohort 11. Congratulations.
So before we wrap up, I just also want to acknowledge the really wonderful team that I have the privilege of working with every day. April Grzinski, who's our Director of Admissions. And April is often the first point of contact for our fellows. Jess Price, who's our Associate Fellowship Director. And Brian Hoff, who's our Director of Online Education, kind of the wizard behind the scenes. Yeah. And Dr. Jean Davis, an alumna of our program, who's curriculum advisor. Thank you, Jean. And the newest addition to our team, who's been instrumental in helping us with our curriculum revisions, Amber O'Neill. So in closing, I would offer this to all of you. And I think we heard this in Cindy's remarks. It is of utmost importance that as all of you venture forward and do this really important work, that you make sure that you take time to stop and nurture yourselves, do that self-care, that self-compassion, that self-love that hopefully we have helped you to cultivate throughout this experience. Because without that, you all cannot show up for others as the best version of yourselves. And I would invite all of you to remain engaged with our Alumni Association. We want to hear from you. We want to know about the amazing and wonderful things that you are doing, because we know you're already doing it, but we want to continue to hear about the things that you accomplish and the differences that you're making in the lives of the people that you serve. We want you to help us bring the next generation of fellows through the program by teaching them and mentoring them. So, and we just, again, are so grateful that you just decided to share this part of your journey with us. And we are just really filled with tremendous pride. And I know that I can say that not just on behalf of the fellowship team, but also on all of the behalves of the board members and all of the staff here at the Academy. So do great things, folks. It's going to be a good future for all of us, because you guys, as we heard, you are the future and you are the change makers. And I think it is an exciting time for us. So once again, I give to you the 2023 graduates of the AIHM Interprofessional Fellowship Program.